I've had it tested on myself, but people have demonstrated significant improvement in that meridian testing system with a very simple 2-minute, even 8-minute exposure to the pulse magnetic field. And nothing I know of that so rapidly and so quickly and easily will adjust the meridians as these magnetic fields will. Well, with that intro, and that was a pretty rapid-fire intro, I'm going to open it now to take some questions. Hold 1 second, I'll unmute the call so we can deal with questions.
Well, can you answer?
We have everybody back here.
No.
Karen, are you there?
Yeah, I'm here.
Oh.
Before we start, if I could ask everybody to please identify themselves, and if you are a doctor or practitioner, also your area of specialty, to help Dr. Pollack address you with your specific concerns and area of specialty. Thank you. Okay. Go ahead.
I'm not a doctor or anything, but I have a question.
Yes.
I'm wondering if there's any other way of getting help without having it cost so much.
Is there any way of getting help without having it cost so much?
That's right. Having to get one of those to block all the noise. Yeah. Well, that's the whole thing. I'm at a point in my life where I can't afford whatever you have there that would work for me. So therefore, I'm just trying to get as much information. But I'm just wondering, I'll go to some of the doctors and stuff and chiropractors and things temporarily. But if it's something that costs a whole lot, I won't be able to invest in it.
Well, this is a problem or an issue that I deal with patients all the time. And I don't have an easy response for you or for anybody in this kind of circumstance. And I know there are lots of people who share the same question, the same concern. There is no magnetic field system that's like the QRS that can do what the QRS does. You could use fridge magnets if you want to help you with your healing problems, but you will not get the same benefits that you get from a QRS.
Just spell the word for me.
QRS.
Q?
Yes.
I barely hear you. I'm going to have to really strain. QRS.
Yes. What you can do, I don't know who you work with. What you can do after the call is, Karen, I guess this lady can call you.
Yes, that's fine.
And you all can have a more specific discussion about the QRS and the pricing, etc.
Yeah, why don't I give you my number and then you can call me after the call, because I think we'd better be able to address it that way.
Very good.
Okay.
And your name?
I'm Karen.
Good.
Okay, thank you.
Thank you.
You're welcome.
Bye.
But I think to further the discussion here, I think individuals obviously have to decide for themselves what they can afford or not afford. People will often have to give up other things in their lives, and I don't mean to be facetious, but when you think about things like pretzels or an extra trip to the mall or something like that, you may have to do that for a while in order to be able to have access to a therapeutic system such as this. I don't disagree that the price is higher than a pair of shoe inserts, magnetic shoe inserts. But my argument is that I think that this is an exemplary system. Let me emphasize one other feature of what supports the QRS programming, and that is that the Russian space program, the International Space Program, is going to be looking at the QRS, or is looking at the QRS, to be placed on the new space station. This is serious treatment, serious therapy, and it has very dramatic and prolonged effects on the body, and can be used over long periods of time very, very safely. That's been pretty well established in all kinds of settings now, with literally tens of thousands of hours of use by people with all kinds of problems. The next question, please.
Yes, doctor, can you hear me?
Yes, I can.
Okay. My name is Christina, and I just got through with a cancer removal of a large tumor in my ovary, which he did a hysterectomy, an appendectomy, he removed the omentum, some lymph nodes. I was in the hospital for a week, and then I was home for almost a week, and then back in the hospital with a blood clot for another week, and now I'm on Coumadin
and I have to be on Coumadin for 6 months. A friend of mine is here, and she scared me about magnetic therapy, and I have rented this thing 3 weeks ago. I've used it intermittently. I have not used it for a week and a half, and I'm highly scared that my cancer will proliferate, along with the fact that my CA-125, which is a blood test that shows the elevation of cancer in your system, was within a normal range before my surgery, and now it's way out of range, up to 181. You know, and the doctor said that possibly it could be due to the surgery and the blood clotting. Now, I'm afraid to use this thing because...
That would be my argument for you as well. Let me ask you, though, what did your friend tell you about magnetic field?
Okay, will you...
I will tell you, my name is Cynthia, and I have had a lot of experience. I don't know what you're doing with magnets. I experience with them that I cannot go near them myself because they alter my field I am so badly affected by them. And people do not have the right information so much of the time they abuse it. It is to be used in very specific cases, and you have to know who is working this with you, and for a very specified amount of time. Anything that is a long duration can be very harmful to the body.
You're raising some really good points, and these are actually points that I could raise myself about these issues. I think one of the reasons, again, that I have started working with the QRS system, and I've done magnetic therapy for 10 years, and I use static magnets extensively for 10 years. I have had more people have problems with static magnets than I've ever heard of with the QRS. I listed a set of benefits about the QRS, what distinguishes the QRS, and what you look for in a sort of an ideal therapeutic system. I agree with you that static magnets used extensively can significantly alter body fields. I have a couple of aura pictures here in front of me, actually, that were taken with somebody with an aura meter who was exposed, that the aura meter tested before going on the QRS and then afterwards. And there was a significant improvement in the body field of that individual. Now, you can believe in auras or you can not believe in auras.
Oh, I work with them. I know what it means.
Well, I understand for you, and the reason I'm talking about this is not just for your purpose, not just for your benefit, but for everybody else on the call.
Right.
Okay, so everybody on the call needs to be aware of these issues.